All set, Jennifer?
All set.
Great. Tell us about yourself and your family members with XLH.
I'm Jennifer, and I've been on CRYSVITA since 2020. My twin sister and I were both diagnosed with XLH when we were 4. I can't tell you how important it's been to have someone so close who understood what I was going through. If I got picked on, or if I was struggling with my XLH, I could tell her, and she would completely understand, and vice versa. Even as an adult, that's been helpful.
And what about your kids?
Both my kids have XLH. When the clinical trial for CRYSVITA started, my sister qualified for it. So she was able to give firsthand reports on how it was working for her. So as soon as it was approved, I talked to my kids' doctor about having them start on it. After he told me about the potential risks and benefits, I decided to start them on it right away. So far, they've both done well.
Did you get on CRYSVITA when it was approved?
I did not.
Why not?
I guess because I put my kids first. It felt like it might be more work than it really was to get on it. I procrastinated. I had this sense that I've dealt with it this long, I can continue to deal with it. That is a terrible mindset when you have a progressive condition, because it can get worse over time, especially when there's a medication that treats the disease and can make a difference. But at some point, I decided I needed to take care of myself. I needed to put my health first. So I did the research and found a doctor specializing in XLH, and I asked him about CRYSVITA.
Has it worked for you?
CRYSVITA has worked for me. My phosphorus levels have gone up and are now in the normal range. I've also noticed when I get up from sitting for a long time, I don't have as much joint stiffness. I know I've had fractures that have healed. Everyone's experience with CRYSVITA is different. Some of the most common side effects include back pain, headache, tooth infection, restless leg syndrome, and decreased vitamin D.
Do you wish you'd found your doctor sooner?
Absolutely. Because I know it's working for me. I'm feeling better. Why wouldn't I have wanted to feel that sooner?
What would you say to someone with XLH who is considering CRYSVITA?
Don't wait to start the conversation. Your health is a priority too. I waited, and I shouldn't have.
Thanks, Jennifer.
What is CRYSVITA? Burosumab-twza. CRYSVITA is a prescription medicine used to treat adults and children 6 months of age and older with X-linked hypophosphatemia, or XLH. Important safety information. You should not take CRYSVITA if you take an oral phosphate supplement and/or a specific form of vitamin D supplement, such as calcitriol, paracalcidol, doxorcalciferol, calcifediol. Your phosphorus levels from a blood sample are within or above the normal range for age. You have kidney problems. What is the most important information you should know about CRYSVITA? Some patients developed allergic reactions, such as rash and hives, while taking CRYSVITA. Your doctor will monitor you for symptoms of an allergic reaction while you are taking CRYSVITA. Your treatment may need to be discontinued for serious allergic reactions. High levels of phosphorus in the blood have been reported in some patients taking CRYSVITA. This may be related to a risk of high calcium levels in the kidneys. Your doctor will collect blood samples to monitor your levels. If you are already taking CRYSVITA, dose interruption and/or dose reduction may be required based on your serum phosphorus levels. High levels of calcium in the blood have been reported in patients taking CRYSVITA. The risk is greater in patients with pre-existing hyperparathyroidism, that is, overactive parathyroid glands, for those who are unable to move for extended periods of time, become dehydrated, have high vitamin D levels, or have kidney issues. If you are at greater risk, your doctor will monitor your blood calcium and parathyroid hormone levels before you start and while taking CRYSVITA. If you develop high levels of blood calcium, your doctor may need to stop your treatment until it is adequately managed. Administration of CRYSVITA may result in reactions at the injection site, such as hives, reddening of the skin, rash, swelling, bruising, pain, severe itching of the skin, and collection of blood outside of a blood vessel, that is, hematoma. Call your doctor if you develop an injection site reaction. CRYSVITA may be discontinued if severe injection site reactions occur. What are the possible side effects of CRYSVITA? Adverse reactions that were seen in children with XLH are fever, injection site reaction, cough, vomiting, pain in arms and legs, headache, tooth abscess, dental cavities, diarrhea, decreased vitamin D levels, toothache, constipation, muscle pain, rash, dizziness, nausea. Adverse reactions that were seen in adults with XLH are back pain, headache, tooth infection, restless leg syndrome, decreased vitamin D levels, dizziness, constipation, muscle spasms, phosphorus levels increased in the blood. Narrowing of the spaces within the spine is common in adults with XLH, and pressure on the spinal cord has been reported in adults taking CRYSVITA. It is not known if taking CRYSVITA worsens the narrowing of the spaces within the spine or the pressure on the spinal cord. Before taking CRYSVITA, tell your doctor about all of your medications, including supplements and medical conditions, including if you are taking oral phosphate and/or active vitamin D, such as calcitriol, paracalcidol, doxorcalciferol, calcifediol, are pregnant, think you may be pregnant, or plan to become pregnant. There is not enough experience to know if CRYSVITA may harm your unborn baby. Report pregnancies to the Kyowa Kirin Inc. Adverse Event Reporting Line at 1-844-768-3544. Are breastfeeding or plan to breastfeed. There is not enough experience to know if CRYSVITA passes into your breast milk. Talk with your doctor about the best way to feed your baby while you receive CRYSVITA. While taking CRYSVITA, tell your doctor if you experience an allergic reaction such as rash or hives, a rash, swelling, bruising, or other reaction at the injection site, new or worsening restless leg syndrome. These are not all the possible side effects of CRYSVITA. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 800-FDA-1088 or www.fda.gov/medwatch. You may also report side effects to Kyowa Kirin Inc. at 1-844-768-3544. For important risk and use information, please see the full prescribing information for CRYSVITA.